This is my idea for Indonesia. According to Pustatin from Ministry of Social, there are more than 11 million people with disability in Indonesia, and World Health Organization and World Bank reported that the gap of school participation between children with disability and children without disability is 60%. It's surprising indeed. Education, especially early childhood education, is vital for all children because it provides the foundation of lifelong learning as well as preventing the potential delays of development. For children with disabilities, it is a vital time to ensure access to intervention which can help them to reach their full potential. Children with disabilities who receive good care and developmental opportunities are more likely to become healthy and productive adults. However, there is lack of early childhood education for children with disability in Indonesia, and this is a serious problem. Therefore, it is necessary to build early childhood special education, or we call it as PAUD luar biasa, to increase access of early childhood education for children with disabilities in Indonesia. Early childhood special education, or PAUD luar biasa, and general early childhood education have the same goal and foundation, but it is specialized for children with disabilities. It can be in the forms of preschool activities, kindergartens, or playgroups. The mechanisms of establishing PAUD luar biasa is as follows. First, the governments, related institutions, and experts discuss about PAUD luar biasa programs and the things which are required. Second, they set the curriculum models for special education. Third, the governments build infrastructure as well as establish education programs to produce teachers to teach in PAUD luar biasa, or we call it as early childhood special educators. And fourth, the government recruits stakeholders for PAUD luar biasa. And the last, government and these stakeholders socialize about these programs to public. State and territory government have to support PAUD luar biasa in poor community by providing education subsidies for them. The requirements is the subsidies granted to a comprehensive programs with nutritional intervention, school readiness, and psychosocial intervention. In jurisdiction, PAUD luar biasa is delivered through a funded provider models, which involve a mix of government, community-based, and also for-profit provider. Based on interviews with parents having children with disabilities, the reason they do not put their children in kindergarten or playgroups is due to lack of services for disabled persons. Children with disabilities have to be recognized and identified from the group of children because they require specific services. Unlike stakeholders in general early childhood education, the stakeholders in PAUD luar biasa consist of transdisciplinary team. It is a group of professionals who assess, plan, and provides education services to children. The transdisciplinary team consists of the family member, the special educators, psychologists, and therapists. The stakeholders participate in planning the comprehensive services. They work together to promote an integrated programs for a whole child. The family, the special educators, psychologists, and therapists work together to create an integrated program that focuses on the whole child. Early childhood education prepares children for further learning, so PAUD luar biasa have to be implemented as a package up to 8 years of age. If early childhood education and care in PAUD luar biasa are provided by the professional, and then the care and education accommodates the needs and rights of children with disabilities, and those who are come from poor family are given education subsidies by governments, certainly more parents are willing to enter their children to PAUD luar biasa. Therefore, our goals to increase the access to early childhood education for children with disability in Indonesia can be achieved.